superficial tumors are a common concern for our canine companions, accounting for a significant 30% to 50% of all tumors in dogs. When these cancers need to be removed, a crucial surgical technique often involves what's called a wide resection, which ideally includes a fascial plane as a deep margin. Think of a fascial plane as a natural barrier of dense connective tissue that can help prevent the spread of neoplastic cells during surgery.
That's right. While the concept of using fascial planes in surgery has been explored for other parts of a dog's body, like the trunk and forelimb, detailed information for the hind limb and pelvis has been less available. This lack of specific mapping for these areas has presented a challenge for surgeons. Therefore, the aim of the study we're discussing today was to meticulously map these fascial planes and their intersections in the canine hind limb and pelvis, providing a guide for excising superficial masses in these complex regions.
The study found that while there were minor anatomical differences between dogs, mainly due to size or sex, these were not significant enough to prevent accurate mapping. Most of the hind limb fascia was categorized as type 2 or type 3, meaning it was adhered to thin or thick muscles, respectively. Areas with discrete, robust fascial sheets, or type 1 fascia, were primarily found in the lateral gluteal region, the fascia lata, and the lateral cruce. However, some critical areas, like the iliac wing and patella, showed type 4 fascia, which is closely associated with bone. Crucially, the researchers noted that fascia suitable for surgical use was thin or even absent in several challenging locations, including the ischiorectal fossa, the femoral triangle, the extensor mechanism of the stifle, and much of the medial and distal cruce, as well as the paw.
These findings have profound implications for veterinary surgeons. The study clearly highlights that while much of the proximal hind limb and pelvis does offer suitable fascial planes for wide tumor removal, regions such as the ischiorectal fossa, femoral triangle, and the entire distal hind limb pose significant challenges due to poor or absent fascial integrity. Attempting to achieve a deep margin in these areas can be complex and risky. For example, the thin fascia at the ischiorectal fossa and the intricate tissues around the genitalia mean a higher risk of incomplete tumor removal. Similarly, removing tumors from the distal limb is tough because of the frequent lack of an effective deep margin. This underscores a vital surgical principle: if you can't go deep, don't go wide. Surgeons must also carefully consider the potential for nerve damage, particularly to the obturator, superficial peroneal, and tibial nerves, which are often located in areas where the fascia is weak.
Absolutely. While it's possible to resect many fascial sheets and even some muscles with limited long-term issues, the surgeon must always weigh the impact of tissue removal on the dog's future function and risk of chronic pain, especially when dealing with load-bearing structures like the extensor mechanism. This research provides an invaluable guide, allowing surgeons to make more informed therapeutic decisions and to plan intraoperative excisions with a clearer understanding of the anatomical landscape. Ultimately, the best approach might sometimes be a more limited resection followed by alternative therapies, rather than risking a highly morbid surgery with an uncertain outcome. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions below, and as always, keep those minds inspired, hearts light, and tails wagging.